What causes wheezing in people with asthma? Have you ever wondered why some people with asthma experience that distinct wheezing sound when they breathe? It's a common symptom, but the reasons behind it are quite fascinating. Wheezing occurs when the airways become narrowed or obstructed, particularly in the small bronchial tubes of the lungs. This narrowing is primarily linked to asthma's underlying inflammation and airway sensitivity. Asthma is a chronic condition that causes inflammation in the airways. When someone with asthma encounters triggers like allergens, which can include pollen, mold, or pet dander, their immune system reacts in a way that leads to wheezing. Other triggers can be viral infections, irritants like smoke, or even cold air. When exposed to these triggers, the immune system releases inflammatory substances from various immune cells. These substances include histamine, leukotrienes, and prostaglandins. The result of this reaction is a series of changes in the airways. First, there is bronchoconstriction, where the smooth muscles around the airways tighten, making the airway diameter smaller. Next, airway edema occurs, which is the swelling of the airway lining due to inflammation. Additionally, the goblet cells in the airways produce excess mucus, which can further clog the airways. All these changes lead to a narrowed airway lumen, or the inner space of the airway. When air tries to move through these constricted passages, it causes the walls of the airways to vibrate, resulting in the high-pitched sound known as wheezing. This sound is most noticeable during exhalation because the airways naturally narrow at that time, making any obstruction more apparent. Wheezing can vary in tone and intensity based on which part of the respiratory system is affected and how narrow the airways are. For instance, obstructions in the lower airways often produce a more musical wheeze, while those in the upper airways may create a hoarser sound. If asthma is not well managed over time, chronic inflammation can lead to structural changes in the airways. This can include thickening of the airway walls and an increase in the muscle mass around the airways. These changes can cause persistent airflow obstruction and more frequent episodes of wheezing. In practical terms, when someone with asthma experiences wheezing, it indicates that their airways are narrowed and airflow is restricted. This can lead to difficulty breathing. Treatments such as bronchodilators, which relax the airway muscles, and inhaled corticosteroids, which reduce inflammation, can help open the airways and lessen wheezing. So, to sum it up, wheezing in people with asthma is caused by airway narrowing due to inflammation, muscle tightening, swelling, and mucus buildup. All these factors are triggered by the immune system's response to various environmental and internal stimuli. Understanding these causes can help manage asthma better and improve breathing for those affected.